Here's a surprising fact. In one study, a single vitamin lowered fasting glucose by 13%, insulin by 28%, and HbA1c by 7%, all in just 6 months. And no, it wasn't vitamin D or magnesium. In this video, you'll discover 3 overlooked vitamins that work quietly overnight to steady blood sugar, boost insulin sensitivity, and reset your mornings. The first one? A so-called bone vitamin with an unexpected link to insulin. Vitamin K2 might be known for bone health, but research shows its role doesn't stop there. Evidence now suggests it also influences how your body handles insulin, particularly during the night when glucose regulation can be more challenging. The connection comes through a bone protein called osteocalcin. Vitamin K2 helps activate osteocalcin, and once active, this protein sends signals that improve how well insulin works. In other words, while strengthening bone, K2 is also linked to better blood sugar balance. Back in 2011, a clinical trial published in Diabetes Care tested high-dose vitamin K2 in the form of MK4, metotretinoin, taken at 30 milligrams 3 times daily for 4 weeks. Even in young, healthy men without diabetes, MK4 improved insulin sensitivity and glucose control. Seeing changes in people who started out with normal blood sugar highlights just how important this pathway might be. A different study looked at MK7, the longer-acting form of vitamin K2, in people with type 2 diabetes. After 6 months of daily supplementation, fasting glucose dropped by about 13%, insulin fell nearly 28%, and hemoglobin A1c decreased around 7%. These results are considered clinically meaningful because they represent improvements across several markers of glucose management. Scientists have also noted that K2 supplementation may influence the gut microbiome, shifting bacteria and metabolites in a way that supports blood sugar balance. Since the gut plays such a central role in glucose control, this could help explain why K2 users sometimes report fewer unexplained morning highs. Because vitamin K is fat-soluble, it's best absorbed with a meal that contains some fat. A small but practical detail like this can improve how well your body uses the supplement. An important safety note: vitamin K can interact with blood-thinning medications such as warfarin. If you take anticoagulants or have a serious medical condition, discuss K2 with your healthcare provider before considering any supplement. But here's the twist: the next nutrient works inside your cells, not in your bones. Coming up, Alpha-Lipoic acid is known as an antioxidant, but its influence goes directly inside your cells. It can move through both water and fat environments, reaching the parts of the cell where stress builds up and blocks insulin from working effectively. This quiet stress, known as oxidative stress, is a common driver of insulin resistance and higher fasting sugar in the morning. By restoring balance, alpha-lipoic acid allows glucose to enter the cell instead of circulating in the blood. Although your body makes small amounts naturally, it isn't enough to produce the effects seen in clinical trials. Supplementation has been studied for decades, with doses most often around 600 milligrams a day, though trials have tested between roughly 300 and 1,200 milligrams. Even at the lower end, results are promising. In one study from Iran, people with type 2 diabetes took 300 milligrams daily for 8 weeks. They saw improvements in fasting, glucose, and post-meal blood sugar, showing benefits across the day, not just overnight. These findings are supported by larger reviews. A 2018 meta-analysis combined results from 24 randomized trials. Consistently, alpha-lipoic acid improved fasting glucose, insulin resistance, and even broader measures like triglycerides and cholesterol. This suggests its effects extend past blood sugar alone, reaching overall metabolic health. Absorption matters here too. Research shows that alpha-lipoic acid is better absorbed on an empty stomach, and some trials gave it before meals for this reason. That doesn't mean there's one universal schedule, though. The safest step is to check with your provider about timing and whether it fits with your current treatment plan. Safety deserves special mention. Alpha-lipoic acid can interact with diabetes medications by enhancing their effect, which raises the risk of low blood sugar. It can also interact with thyroid drugs and some chemotherapy agents. If you already use glucose-lowering medication, it's important to monitor more closely and confirm with your clinician before adding this supplement. You can think of alpha-lipoic acid like a cleaner inside your cells, removing oxidative buildup so insulin can do its job with less resistance. And while that helps insulin work better, the next nutrient takes a different approach. Wait until you see this, a sugar lookalike that helps the insulin signal itself. Inositol is unusual because it looks like sugar but acts very differently in the body. Rather than raising blood glucose, it plays a key role in how insulin signals are carried inside your cells. This makes it especially relevant overnight, when your body depends on insulin signals alone to keep glucose steady. There are two forms most often studied: myo-inositol, MI, and D-chiro-inositol, DCI. Think of them as messenger molecules. They don't replace insulin, but they help relay its signal inside the cell so glucose can move in more easily. When this signaling improves, fasting glucose often drops, which is especially helpful for those persistent morning highs. Clinical evidence supports their role, but the details matter. In a 2016 pilot study, people with type 2 diabetes who took a combination of MI and DCI for 3 months showed reductions in fasting glucose and hemoglobin A1C. Beyond that single trial, a meta-analysis of 20 randomized controlled studies reported consistent improvements in fasting glucose, fasting insulin, and the HOMAIR measure of insulin resistance. That wider base of evidence shows that inositol effects are reliable across different groups and settings. Dosing and formulation are important for safety and effectiveness. Common clinical doses range widely, from about 2 grams daily in studies on gestational diabetes and PCOS to lower-dose MI/DCI combinations used in type 2 diabetes, like 550 milligrams MI plus 13.8 milligrams DCI twice daily. High doses of DCI alone, especially when used long-term, have been linked to hormonal disruption in some women. This is why most supplements use a 40-to-1 ratio of MI to DCI, a balance that reflects the physiological ratio found in the body. More DCI is not better, and using that ratio makes supplementation both effective and safer. Always confirm with a clinician before starting, especially if you already take glucose-lowering medication. You can also find inositol in everyday foods. Beans and other legumes, whole grains, and nuts are practical sources that provide small amounts naturally. Vitamin K2, alpha-lipoic acid, and inositol each help steady your blood sugar while you sleep, but what you do after you wake up matters just as much. The right morning habits can carry that stability through your whole day, giving you lower numbers and better energy. Tap the video on screen now to discover the top 3 morning habits that lower blood sugar all day long. Don't miss it. It's the perfect next step.